So delirium is an acute confusional state, and it is often a manifestation of acute illness or surgery or some type of perturbation occurring in often an older person. And it's highly interrelated with dementia. Dementia turns out to be one of the leading risk factors, in fact, for people developing delirium. And vice versa as well. It turns out that delirium is also a risk factor for subsequent dementia developing. So they really are highly interrelated, and that's what I'll be focusing on in the session. There have been years of studies looking at risk factors for delirium across all different populations, because delirium commonly occurs in the hospital, in surgical populations, in ICU populations, in nursing home populations, palliative care populations. And consistently you see across all of these studies and all of these populations that dementia is a very strong risk factor for developing delirium. And so it really appears that in people that have vulnerable brains, so maybe not even full-blown dementia, but mild cognitive impairment, there is an increased risk for developing delirium. It looks like that risk translates into about 4 to 5-fold increased risk, which is really striking. And then looking at the other way, a systematic review was published in 2020 that looked at over 25 published articles that had looked at the relationship of delirium with subsequent long-term cognitive decline. And that study did a systematic review and meta-analysis of these over 26 studies, and did show that delirium was significantly and substantially associated with long-term cognitive decline, even after controlling for pertinent confounders. And they estimated the risk associated with delirium, for long-term cognitive decline of about between 2 and 2.5 in that range.